I'm Mariana Angel, and this is my head-to-toe newborn assessment video. Today, I have with me my baby, Charlotte. First, Charlotte is going to get started with an APGAR score. This is rated from 0 to 2, and it is in between 7 and 10 at 5 minutes. If she is rated under a 6, we will reassess at 10 minutes, but this usually indicates that something is going wrong with baby, and we will need to further assess. An APGAR score is rated by its heart rate, reflexes, muscle tone, respiratory effect, and color. Next, we're going to take baby's vital signs. We're going to start with her heart rate, and her heart rate is usually between 120 and 160 beats per minute. When baby is crying, it will go up to 180, and whenever she's asleep, it'll be at 100 beats per minute. Next, we're going to do her respiration, so we're going to uncover baby just a bit so that we can watch her chest rise and fall. This is going to be in between 30 and 60 beats or respirations per minute. And babies actually have periods of apnea whenever they're born. This can be a chance. This is going to be in between 5 and 15 seconds. But this is completely normal, and we'll have to reassure mom that everything was going to be okay. After that, we're going to take her temperature. So still keeping her covered, we're going to get that rectal temp. It is 100.2 or lower is the right temp for rectal. Also, by doing this, we are making sure her anus is patent and open. And sometimes babies can use the bathroom while you are doing it, and that will be their first meconium stool. And even if it doesn't happen at that moment, they will have their first one within 24 hours. Next, we're going to do a blood pressure, but on babies, we typically don't do this. If we do, it will be on their thigh. This can range from 50 to 75 systolic over 30 to 45 diastolic. But again, we don't typically do that. Next, we're going to measure her body. We're going to unwrap her, and for educational purposes and just this video, I am going to unwrap her. Again, you will want to keep her wrapped at least hopefully the entire time. Next, we're going to first do the circumference of her head. It'll be above the ears and above the eyebrows. Got that. And then next we're going to do baby's chest. So we'll go under baby. And also with the chest and head circumference, you want to make sure that they're at least 2 to 3 centimeters apart from each other. If they're not, this can be an indication of chromosomal abnormalities, and baby could have Down syndrome. Also, it could be a chance that if the mom is really small, she could just be small for her gestational age and just a small baby. It really just differs. Now that we've measured that, we're going to do a neuro exam on sweet Charlotte. First, we're going to check her eyes, and we're going to make sure that there is no drainage. No drainage, no pus, nothing is going wrong. We see that her nose are patent. She's breathing in and out her nose. Her mouth, she looks good. There's also pink mucous membranes, which is exactly what we're looking for. And we're going to look in those ears. We've already sucked the ears out and the nose out. That was as soon as she came out and had her first breath. And then next we're going to do her sucking reflex. So we're going to put our glove finger, in her nose, and we're going to let her suck on the finger, which shows that she will have good latching attachment on mom when she's breastfeeding. So she's sucking on the finger, and while she's sucking, we're going to feel at the top of her palate for Epstein pearls. And those are white little cysts. They're very normal. They're in a lot of babies. They go away over time, but you will feel for them. And then after that, we are going to do the rest of her reflexes. So next, we're going to pick baby up, and this is called the startle reflex. As we're placing baby down, we were going to tilt her head slightly and place her down. And as we're doing that, she's going to excite her extremities and pull them back in, or excite them and keep them out. It really just depends, but that shows that she is like, whoa, wait a minute, like something's going on. She feels like she's falling. So after that, we're going to do the Babinski reflex. This is where you have baby's foot and you do a slight little feather movement, and her toes are going to flare and that thumb is going to stick up. Next is the tonic neck reflex. Whenever we turn baby's head to one side, the opposite end of the extremities are going to flare out. They're going to expand. And then same for the opposite side. You turn baby's head, this side will go out. So head turn, out, head turn, out. This is a very normal finding and very good for baby. Next, we're going to do the Palmer reflex, which is grabbing baby's palm, and you put your finger in there and she will grasp your finger. It's the cutest one. And then next is the plantar reflex. You're going to do the same thing right under the toes and she will grip over onto your finger. After this, we're going to do a thorough skin assessment. We want to make sure that we check everywhere on baby. We're going to start with the chest though, because that is the most important part, is especially when she first comes out of the womb. If her chest, her trunk, or her mouth is blue, she is not breathing properly, and this is definitely a sign of respiratory distress. She could be retracting, and that is whenever her rib cage goes in from breathing. She could have nasal flaring, bursts of just gasping. There are a lot of different signs that could go wrong with baby and breathing. So we definitely want to check the color. She has no jaundice, no cyanosis. She does have acrocyanosis, which is blue of the extremities. We know that cyanosis was the mouth, trunk area. Well, this is just the extremities, and it's a total normal sign. It will go away in time, and it also just means that it was a trauma birth, so baby went through it for a minute, and her circulation is just working back into itself because she was in such a tight ball inside mom. Next, we're going to do different skin assessment of birthmarks. There's a few that I wanted to talk about. There is first a strawberry hemangioma, which is a benign strawberry birthmark. It's very common. Next is a stork bite, and this is smaller strawberry spots, and they're typically seen on the back of babies' necks. They can be other places on the face. That's just typically where you see them, and they blanch whenever you press them. Next is a port wine stain, and these are not blanchable. They are just like the other strawberry ones, but they're a bit darker, and they can range in size. So these can be very small to very big. Next, we are going to talk about the Mongolian spot, which is on darker skinned babies, and you will normally see it at the top of their sacrum back here. It looks like a big bruise, but it is a completely normal finding, and you can assure mom that baby wasn't dropped, nothing's wrong with baby. It's just a Mongolian spot. Next, we're going to talk about the Harlequin sign. And this is whenever there is a straight line down baby's extremities where half of her is red and the other half is pallor and white. She's going to be really pale. This is also a normal finding. It will go away in time for sure. But like I said before, baby, her circulation is working its way through her body again because she's finally stretching out and she can move. Next is the vernix. So the vernix is a white coating that's all over baby. It's from the amniotic fluid being in the mom. It's very good for baby's skin. A lot of moms will suggest not to even wash baby for a while to keep that good coating on their skin because it moistens it and it's very good for it. But in preterm labor, those babies will have a lot more vernix. And this post-term baby or at-term baby, they will have just a few of it. You'll normally see it in the creases of their arms, back of the legs. If it's a female, like Charlie, you'll see it in her genitalia. But again, it's very normal to find. And then next, with different ethnicities, babies can have a lot of hair all over them, on their back, more on their forehead. It can grow anywhere. This is called lanugo, and it's also a normal finding. Next, we're going to talk about melena spots. This is whenever the pores are clogged and you will have it on the tip of your nose, your cheeks. It's just white little spots and they will go away in time. Next is the caput succedaneum. Caput succedaneum, sorry. This will be whenever baby has a suture at the very top of her head, right there in the center. And so whenever she's being birthed vaginally, this can happen from the uterus, or it can happen if baby is being vacuumed out. If it is over that suture line, she will have a lot of swelling on her head. But if it's before the suture line, this is called cephalinomatoma. And this is whenever it's before that suture line, so it's going to be a bigger bulge, and there's going to be some swelling, probably some blood in it. It will also go away in time, but it will be like the shape of my hand right now. It will be a little bit bulged out, as if it were past that suture line, it would be a little more even. Then next, we're going to check her the simian crease. This is on the palm of the hand. Your simian's crease is this right here. If baby doesn't have simian's crease, this can be another chromosomal abnormality, and baby could have Down syndrome. Next, we're going to check baby's fontanelles. We're going to lift baby up. And again, we would have her covered during this entire thing. We have the anterior fontanelle, which is at the front of the head, and then the posterior fontanelle, which is at the back of the head. The anterior one is a diamond shaped, and it closes at 18 months. On the back of the head, this one is going to be a triangle shape, and it closes at 2 months of age. We know that with fontanelles, we want them to be flat. They're pretty squishy. They're very soft. You want to be very careful with them, especially when they're first born. If they are bulging, this can be a sign of intracranial pressure, and if they are sunken in, this is a sign of dehydration. Next, we're going to check the body extremities and all her limbs. We see that she has all her arms, her feet, her legs. She has both of her ears, and with the toes and fingers, she has 10 of each. There are no multiples, and also no webbing of the feet. They're all separated evenly. Okay, and then next we're going to do baby's chest. So she has no abnormal respirations. She has no distension, no masses, nothing bulging. Her stomach is round, and I am going to check her stomach, her abdomen. So first, I will check the lower one, and then the right upper, left upper, right lower. And as we go in that circle, we want to watch for baby's face for any grimacing throughout the whole assessment, really, to see if she is in any pain, since baby can't really tell us if they're in pain or not. Then we would check the capillary refill on her feet, and we would check it on her hands. If baby's having her O2 done, we would do it on her right arm, since the oxygen goes better that way for her. And then we have to be reminded that the alveoli is very sticky, and so whenever we're checking her lungs, baby will have crackles. That can be a normal sign. We will check all of her lung areas up here, get her up, we'll check her back, and then we will check her 2 lobes on her side, and we'll check her 3 lobes on her right side. And again, crackles can be found since she was just in a bunch of amniotic fluid. Next, we are going to do her heart. We're going to check her aortic pulse. This is going to be in between the fourth intercostal space. In adults, this is going to be between the fifth intercostal space. And then, sorry, my phone just said 20%. Back to what I was saying. Next, we're going to check the hips. So for the hips, we're going to do the Barlow's anomalies. This is where you pull the baby's legs, and then you're going to lift up to her chest, and then you're going to frog them out and get that good hip flexion. If her hips have any cracking or popping, that is a sign of either dislocation or something is not in the right position. Baby has something going on with her that we definitely need to get checked out down there. And if baby is in pain and she's squealing, crying, the bursts of cries are very normal. If she is screaming at a very high-pitched sound, this could be a sign of opioid withdrawal, and we do not want that. We would have to assess mom, her, the stool, everything to get her checked out. So now that we have done the hips, we're going to sit her up and we're going to look at her spine. The spine is straight, looks very normal. We're going to check her dimples. We're going to check the back of her legs. We're going to check under her arms, the creases of her neck. Lay baby down. We're going to check her genitalia. And she has her labia. She has every female part that she needs. And we do want to assess all of that. And with the temperature and the assessing the anus patency, if that wasn't checked normally with a rectal temperature, you would insert a gloved finger into the rectum to make sure that it is open. Because there can be chances where baby doesn't have their first stool because the rectus is closed. Next, we're going to talk about the 4 different ways that baby can get cold. Because, like I've said several times in the video, since they were baking in that hot oven, baby can get very cold easily. And the 4 ways of making sure that they are warm is first, evaporation. Whenever baby comes out, she's smothered in amniotic fluid, and that fluid just evaporates straight off of her. So she's going to get cold very fast. Next is conduction, and this is whenever the baby is naked, out on a surface, with nothing underneath her either. And whenever the baby comes out, we want to make sure we dry her thoroughly and stimulate her to get that thermoregulation. But even after we dry her and we have that blanket still underneath her, she can still have conduction issues because that blanket underneath her is still cold. So we'll want to take that out and get a new blanket, towel, whatever it is that we're wiping her off with to have underneath her because she's very susceptible to getting cold. Next is radiation, and this is when the baby is placed next to a cold wall or door or whatever she is near can be very cold and go to her. Next is convection, and this is whenever the baby is exposed to cool air and cold draft. So if baby's in the crib, you want to make sure there's not an air vent underneath the crib or above the crib, no fans on. And if baby is in a cold area, you want to make sure she is dressed appropriately for the weather. Next, we are going to talk about breast engorgement. This is whenever mom is lactating and her breast milk has come in. The breast can get very enlarged and very swollen. It's painful. She, especially in the first 48 hours of baby being here, she wants to make sure to be breastfeeding at least every 3 or so hours to make sure that she is not getting engorged. If she stays engorged, this can lead to mastitis, and this is an infection of the breast, which can lead to a prescription of antibiotics to cure, because it is very, very painful. You do not want to wait a long time between breastfeeding. Next, I want to talk about how baby's oxygen works. So when baby is in the womb, everything is actually working completely backwards from then how it's working whenever you come out into the world. So we know that the umbilical cord attaches to baby and it attaches to the placenta. Well, the placenta attaches to the inferior vena cava, and that your oxygen comes from. After that, it's going to go into the right atrium and then through the ductus venosus. It's going to bypass the liver and it's going to go through the left atrium, through the foramen O valve, and then through the aorta to the ductus arteriosus. Those are the 3 shunts, and when the baby takes her first breath, all those shunts are going to close, and then everything reboots itself back, and you are breathing just how you normally should. We know that in the umbilical cord there are 2 veins, 2 arteries, and 1 vein, and in in adults, we know that veins carry deoxygenated blood. So in the baby, the vein is actually what is carrying the oxygenated blood, which is kind of cool. And then after that, we're going to check baby's umbilical cord. So we're going to unwrap baby, and while we're looking at the umbilical cord, we want to make sure that there is no discharge, no drainage, no signs of infection, everything looks good. We know that the umbilical cord has Wharton's jelly all over it, which is a thick, slimy substance that is all over the placenta and the umbilical cord, so whenever the baby is inside the uterus and she's smishing up on everything, the cord, if it's compressed, it won't get damaged, it won't mess anything up. Everything will just stay normally how it should be. So we know that baby is all good. That is my head to toe newborn assessment video. Thank you so much for watching.